Hello, Dr. Alexander Dayanaev here from Steinway Family Dental Center. We get a lot of questions about dentures, and today we're going to discuss some of those questions that you have about dentures. The first questions we have is, what are dentures? Well, dentures is a prosthetic device that replaces missing teeth for the person. It could be one or all missing teeth. The next question is, what type of dental professional would I see about dentures? I would say you see your regular dentist. If your dentist is for some reason not capable, or you think that your case is too complex for you, then she would refer you to prosthodontist. It's a specialty that deals with the replacements of teeth. However, most dentists are quite trained on it, and you can have denture made by your dentist. Or you can come here and I can help you out with that. The next question is, when would the dentist recommend getting dentures? So there's different types of dentures. Sometimes the dentist would recommend you to get denture as a temporary solution while you're waiting for your implants to heal and you would get more permanent prosthetic device. And sometimes, based on the cost of the prosthetic device, denture would be the choice for you, and that is when the dentist would recommend it for you. The next question is, what are the alternatives to denture, and when would it be best to get each alternative? Number one, the best alternative to denture is something that is not removable. Most dentures are referred to removable prosthetic device. So when we're talking about non-removable, of course it is more comfortable. It could be a fixed bridge that is not removable. It consists of few crowns made together in a roll, and then that would replace the missing teeth. So it gets cemented on your teeth, and you don't ever take it out yourself. The next one would be if you get implants. That is also an alternative to dentures. It's just that implants may take a little bit longer for you to get start to finish. Therefore, maybe temporarily you may need something removable, some dentures. The next question is, what type of dentures are there? They are either partial dentures, when a replacement is for some teeth but not all the teeth in the jaw, or full dentures, when all the teeth are missing and the denture needed to replace all the missing teeth. The next question is, how are dentures made and what materials are used? Well, the dentures are custom made, and even the denture, let's say, for the upper jaw will not fit on your lower jaw, and vice versa. The denture that's fabricated for the lower jaw will not fit the upper jaw. They are different, and the different types of dentures, it could be the materials that's used. First of all, there could be a metal frame used for the dentures. There is a material that is acrylic dentures. They're usually used for complete dentures when there is a full mouth needs to be done in dentures. Then there is dentures that has flexible plastic, and it is probably the most comfortable dentures because the plastic is flexing and then hugging your teeth to stay in place. It's usually used for partial dentures. So those are the different types of dentures. And of course, there is a combination of a metal frame with flexible plastic and so on. The next question is, what happened during the denture placement procedure? So when your denture is fabricated, the dentist will help you to put it on and check the denture for fit, and for your bite will be also addressed and checked. If all of this fits perfect, your dentist may choose to train you on how to use your new denture, how to put it on and take it out. And then, of course, it's your responsibility to eat with the denture and get accustomed to it. If you have any questions about that, or if the denture is bothering you, you can go back to your dentist and have him address that. If you can't find anybody and you already have existing denture and you need some help with that, you're always welcome to call us and we'll see what I can do to help you with your denture. The next question is getting denture painful? Well, absolutely not. Getting denture is not painful. It may hurt your feelings, but other than that, it is not painful. The next question, what anesthesia option will be available during the denture procedure? Well, you don't really need any anesthetic during the denture procedure. It is not an invasive procedure. There is no cutting. There is no drilling. If denture needs to be adjusted, it could be taken out of your mouth and then drilled and then put back in. So that's the actual drilling that you would appreciate to have. The next question is, what should I expect my dentures look and feel like? Well, it looks like regular teeth, right? But it feels slightly different. And you should feel that the denture is giving you the support that you need, and now your face looks a little bit better. It has the necessary support for your muscles. because if you're missing teeth, then the muscle that will be called synced in, right? So your whole facial structure will be synced into the missing dentition. But since you get the denture, it will be restored with that. So you should feel much better and more confident with your new teeth. The next question, is it more difficult to speak with dentures? Well, yes and no. At the beginning, of course, there is a learning curve, but your muscles generally know what to do and you will be speaking perfectly with your new dentures. It's just that your brain stands in the way of your muscles and remind you that there's something foreign in your mouth. And this is why we get lisping sounds and so on. But as soon as you forget that you get the denture in, you'll be speaking perfectly. The next question is, will having denture affect my ability to eat and drink regularly? Well, I hope it fixes it and it gets changed for the better. Because now that you have the teeth, you can use them and chew your food properly and actually swallow your food that is chewed and not just swallow. And of course, it's much better for your stomach to have food that has been chewed. The next question is, what is the best way to clean and take care of the new dentures? Well, the best way is to get a special denture brush. Denture brush is a little bit bigger than a regular toothbrush. So it has a little better control. It has a more sturdy handle, so you can take the denture out and brush them outside with it. There's a small piece of brush that is designed specifically for crevices to get inside the denture and clean out. So you can clean all the unwanted food particles there. So another thing that you can do, there is a company that makes Effident tablets, what they do, and you can buy it in any drugstore. It's Effident tablets. You put one tablet with a cup of water into the denture holder and put your dentures in it, usually about 3 minutes, and you're done. And you can take it out, brush it. You can use regular soap if you would like, but it's very simple. You brush it with your brush, you rinse it out, and you can use it again. The next question is, what special care should I use for my mouth after getting dentures? Well, you want to clean your dentures regularly, right? And when you're not wearing your dentures, you want to keep them in the water. So the denture made out of porous material, if you have food getting stuck to it and it gets absorbed and the denture dries, then the denture will be very smelly. So you won't like it very much to use the dentures because there would be some odor and taste coming out from this. So you want to keep your dentures clean. Your mouth also, you should brush your teeth more often without your dentures, of course. You should take the dentures out, brush your teeth, and rinse your mouth. And then you can put your dentures back in. The best way would be to do that after each meal, but if you do it at least twice a day, that would be okay as well. The next question, how long dentures will last? It depends on how you take care of them and if there is any changes in your mouth. Generally speaking, if your mouth doesn't change, the denture will last you many, many years. If your mouth change, for example, if you lose one of the teeth, then it could be added to the existing denture. But of course, it's not as perfect as getting the brand new denture. Therefore, take care of your teeth and keep your dentures for a very long time. The next question is, how long will it take for my mouth to heal and get used to the new dentures? Well, again, the second you forget that you have the dentures, you'll be speaking perfectly. But if it's a brand new denture and this is your first set of dentures, again, as soon as you forget you have them on, you speak perfect and to eat your food. And the important thing is to be adventurous and try different food. You start slow with something soft and you progress slowly but surely with different type of food. And eventually you can use these dentures for anything. But there is a difference on how you chew with the denture rather than with your own teeth. We tend to chew on one side when we have our own natural dentition. And when we have dentures, chewing on one side will flip the denture off the place that they're supposed to be. And you would need to spread your food evenly to both sides and chew on two sides. Kind of like the car that drives on the road. It's not a bicycle, so you don't drive on left wheels, the right wheels. No, you drive on all four wheels, right? So the same thing with your denture. You would need to learn how to eat on two sides. Then it is very stable. The next question is, what if my dentures need to be repaired or some of the teeth need to be added to it and so on? So you would need a dental professional to help you with that. You would have to go to a dentist and have the dentist take care of that for you. The next question is, what is the cost for a denture, and will insurance company help paying for it? The answer is most insurance companies do have a denture on the list of services that they provide, unless it is an HMO plan, which will pay practically nothing for it. But most insurance company will want to share the cost of a denture with you, and they would cover something, but they would not cover it in full. The next question is, when should I schedule an appointment for dentures? And the answer is, if you're missing teeth, you should schedule your appointment now. If you don't have your dentist now, then you can call my office here at Steinway Family Dental Center. Again, my name is Dr. Day Knight. Most people call me Dr. Day. You can ask to schedule an appointment with me or with one of our other associates. The telephone number here is 718-728-3314, or you can get it online on alldentalneeds.com and request an appointment.